Waiting, huh? Waiting. Okay, we are live now, right? Okay. Okay, good evening, everyone. It's a pleasure to meet you guys again this week. After last week's interesting session, today I've prepared together with my team to bring you a very interesting and a very eye-opening session. When we say weightlifting, it is a double-edged sword. Why do we say so? Because both sides can cut. It's either you cut the good one or you cut with a bad one, right? So there are good and bad in weightlifting. Not every, the bad comes in. Let's talk about the bad first. The bad comes in when simply you don't do the right things or do the proper optimal things for your body and the exterior tools, using the exterior tools, which are the dumbbells, barbells, your body itself and everything. So that's when the bad side comes in. I hope everyone is doing great. Everyone is doing wonderful during this time. And bringing this weightlifting topic to you tonight, I hope you will benefit from it because we have currently extended MCO, another 2 more weeks, total lockdown. So being in our house, not active, might get us unhealthy. So let me share with you a few things that you can do at home, lifting weights, and what are the benefits of doing it. Okay, let me share my screen to you all. Now we are in. Okay, weight training, the double-edged sword. All clear, huh? All right. Why I've explained, so why it is a double-edged sword. So when I say weightlifting, it does not only mean dumbbells, barbells, kettlebells, and things that normally comes into our mind. Weightlifting, the weights itself, it has few different types. It's either free weights, which are always in our mind, which are dumbbells, resistant bands, say barbells, and some other free weight machines as well. And there are also machines where you can sit on it or you can lie on it and do the exercises. For example, seated chest press, lat pull down, leg press. For those who are regular gym goers, these names should be familiar for you all. For those who does, say, calisthenics, bar, body weight exercises, the push-ups that our father taught us years ago, whenever we were 10, 11, 12, we wanted to look good for the boys, especially. We wanted to have some muscles. We wanted to show it off. So the first thing that our fathers would have taught us, especially me, taught me, is to do a push-up, where I was not able to even carry my own body weight at the age of 12 all the way to 14 years old. At 14 years old, I was not able to do a single push-up. That's not a joke. And it is something serious because this is what is happening in our lives nowadays. The strength that I did not have during those period have left me socially down because I couldn't perform in sports events in my schools. And on routine base, I could not perform my house chores to help my mother. I could not carry a gas can. I could not lift something for my father. So these things affect us physiologically and also psychologically. All right. Lifting weight is beneficial to all of us. But why? Before that, number one, why you should lift weight. Lifting weight is not all about muscles. I know every one of you would be looking for those words showing bigger muscles, higher strength and all that thing, but I prefer to start the slides with bones. Increases bone mineral density. How many of us do know that? Do you know that carrying those dumbbell actually improves your bone mineral density? Many don't know. That is why they don't want to lift weight. Whenever we talk about lifting weights, it's all about muscles and muscles. But do you know that muscles can actually increase your bone strength? Bigger, stronger muscles can actually increase your bone mineral density. And that goes into another interesting fact. There's a question down there. Let me ask you all. Should women lift weights? I see live chats. Answer. I'll wait for your answers. Should women lift weights? If you can see, I've also put a picture of a woman lifting weights. I'm waiting for you all. Give me something. Should women lift weights? Yes or no? Interact with me. If it follows our culture, there you go, Mula Naomi, she said can. If it goes upon the Malaysian culture, the Asian culture, women's don't do that. If you see all those white people, the Americans, the Europeans, women's do lift weights, but we don't. And we always say that lifting weights are for men, lifting weights are for the boys, lifting weights are for the, say, alpha. But women's benefit a lot from weightlifting. Do you know why women should lift weight? The next slide will explain. Women are more susceptible to have osteoporosis than men. Do you guys know this? After menopause, women have higher tendency to actually have osteoporosis due to the hormonal changes. And 77% of Malaysian women with post-menopausal osteoporosis are undiagnosed. They don't even know. Do you know why? Osteoporosis has no symptom. It doesn't tell you that your bones are actually breaking, that your bones are actually dying. You develop that without knowing it. So why did I put this interesting fact into my slides? Is that to say women must lift weights, not to be bulky, but to at least sustain their bones during their elderly ages. All right, so don't wait until it breaks. Let's move on. The next thing, enhances. I can see a lot of you commenting. Thank you very much. Keep interacting with me. There's a lot of fun things coming up. All right, and you can also post your questions. I'll be looking at it. John, Shuada, Nila, Nora. All right, just post your questions. I'll answer at the end of the session. The second thing, it enhances the cardiovascular health. So when you train, so-called the cardiac muscle, which is the muscles of your heart, strengthens. It becomes stronger when you train, when you lift weights, right? When it becomes stronger, you see, the function of your heart is to pump those bloods to the entire body. If it is stronger now, there will be more blood going on, right? There will be lesser effort from the heart for it to pump to the entire body. So stronger muscles, stronger heart muscles specifically means more blood, easier flowing around your body, which will actually reduce resting heart rate. Resting heart rate, how do we know what is our resting heart rate? My resting heart rate, I count my resting heart rate every single day. My resting heart rate averages around 43 to 53 BPM in the morning. Resting heart rate, I'll teach you guys something today. Take your notes. When you wake up, in those few minutes, 10 to 20 minutes of waking up, put your hands here and get your heart rate for 1 minute. And that is your resting heart rate. Why it is so important? Resting heart rate shows how fit is your heart, how strong it is, how easily it is managing all its responsibility. That machine, which is your heart, does not stop since the day you were developing in your mother's stomach until today. It stops, you stop, right? So train. The stronger it gets, the harder for disease to actually attack it. All right? So reducing resting heart rate is a beautiful, interesting benefit that you can actually gain from lifting weights. All right? It is not just about muscles. See, number 2. Let's go. What else? Oh, beautiful. There's another interesting fact for all of you. Do you know Malaysia is the fattest country in Southeast Asia? Why did I suddenly jump into overweight population in Southeast Asia? Are we proud of this thing? We should not be proud of this thing. We are the fattest. We are not the fastest. We are not the quickest. We are not the lion, but now we are the fattest among all Southeast Asia countries. You can see here, I've put in the stats. And if you actually look at it, we are far ahead, fatter than the other countries. Why is this happening? This is happening simply because of the culture that we have normalized over the past generations. We have always asked people, have you eaten? In Malay, dah makan ke? Have we ever asked someone who we just saw, or our relative, or someone who walked into our house for some function or something, have you ever asked them, did you exercise today? It is not the norm. People would laugh at you if you do that. But if you enter my lives that I do in my Instagram, I always ask that question because I'm here trying to implement this culture that we all should be active. We all should be more healthy because always eating is not going to make you healthy, but always exercising is going to. So ask after this, I say, I'm not going to say that don't ask, have you eaten or not? After you ask that, try to ask them, do you exercise today? Or first, ask yourself, did you exercise today? I did lift weight today. I did my squats. I did my wide squats. I did my calf raises. I did lift weights today, and I feel energetic to talk to you at night. I'm not feeling sleepy. I'm not feeling down or whatsoever. So remember, Malaysia is the fattest country in Southeast Asia, and we have to change this. We have to change this. We means the population around my ages, the young ones right now, we have the power. Not only the young ones, but you who are at your 30s, 40s, 50s, you can still exercise. Refer to the proper personnel and get your exercise program. Start today, slowly. Start by walking, start by jogging, start by lifting a little weights. All right, let's go. Next one. Okay, now we have some muscles story coming in. Increases lean mass. Lean mass is basically whatever weight that is in your body, the mass or the matter that is in your body, except fat. Okay, your bones, your water, your muscles, all these things are important, and all these things will actually make you to function better, right? So when you increase your lean muscle mass or lean mass, sorry, by lifting weights, you will actually increase metabolic rate. So what is metabolic rate? Metabolic rate is basically the amount of energy your body is burning or using a day. So when you have more muscles, you actually use more energy. When you have more fat, you use less energy. So what I'm trying to say here is that when you have more muscle, you burn more fat. So now you know that muscles are not your enemy, especially those girls, women out there. You have to train. The toner, the more muscle mass that you don't have to have big muscle mass like Arnold Schwarzenegger had. You don't have to. You just have to go 2 to 3 kilos extra of muscle mass or lean mass. You can actually use more fat in your body, which reduces fat mass. So lifting weights actually reduces fat mass. Not only walking, not only jogging, not only running like a crazy guy, fast. Really, I always meet people who run fast to burn fat. That is another topic for us to discuss, because running fast is not going to burn your fat at all. That is why we encourage walking. So lift weights and reduce your body fat. The next thing that we are going to touch is diabetes. 1 in 5 Malaysian adults have diabetes. They are diabetic. My father is a diabetes patient. My mother is a diabetes patient now. So why I encourage them to lift weights. My father lifts weights. My mother lifts weights. My sister just started exercising, right? So my entire family exercises. So you guys, I'm sending this message to all of you to encourage more people Get them into exercise, because diabetes, hypertension, high blood pressure, and obesity, we are the king. Malaysia is the king. You know why? Because we don't exercise. We don't like to exercise. We have to change this. We have to make this our culture. So lifting weights actually prevents and manages type 2 diabetes. If you lift weights, your sugar level in your blood goes to normal. We have seen, I am an exercise therapist who work in an exercise clinic. We have trained clients, we have trained patients who, from having excessive blood sugar in their blood to normal, we have brought them down to normal, reduced their medication, and increased their quality of life. That is the basic. You want to increase the quality of your life, you want to live longer, you want to live better, you want to live healthier, right? Next, I've already discussed this thing. 1 in 5 Malaysian adults are diabetic. 422 million adults have diabetes. Not to exclude the kids, they are also one of this. They have the tendency to have diabetes. So take care of them as well. Next, as good as it sounds, I've already shared multiple, in a very simple way, benefits of lifting weights. But as I said earlier, there are some bad, there are some negatives, but these are not from the exercise itself. It comes from us. The negative side of weightlifting is actually from us. So as I say, as good as it sounds, if not done properly by the human, there are a few negatives. Let us look at it. Improper technique leads to injuries. Why do we have improper techniques? We don't have proper guidance. We don't learn properly. Whenever we go into a gym, we just crash everything and we come out. This thing in long term will actually cause wear and tear. You might have joint pains. I have had joint pains before when I did not know how to train. I just had to educate myself slowly on how to train. So proper technique is very important for us to continue lifting weights. Not only lifting weights. If you lift a gas can, in Malay, tong gas tu, if you lift it without proper technique, you are going to have backache. That is normal. So lifting weights from the external environment, you have to have proper technique to actually maintain good body posture so that you won't have any pain. The next thing is delayed onset muscle soreness. So muscle soreness is usual. Muscle soreness occur because whenever you do something new to your body, your brain gets triggered. Your brain feels like, why there's something new that is hurting me? Why there's something foreign that this human is actually doing to me? So your brain feels not safe and triggers all this soreness to keep you not doing it. But these are the way that you train your brain, because our brain is as forgotten that we used to be a very, very active individual. Our ancestors, nenek moyang kita, used to be a very active individual. They used to walk 20 miles a day, up and down, running, walking, swimming, might be, all right? So we have to train our brain back, we have to train our muscles, but delayed onset of muscle soreness will actually reduce as you train. For the first few days, it will be, it won't be severe. You might have moderate pain, but as you go on, it will reduce. But if you train at a right dosage, if your exercise program is prescribed according to all exercise principle, which one of the most important thing is progression. If today you are starting to exercise after a long time, you don't go and do 50 push-ups. That is going to hurt you tomorrow. So you start with 5, you start with 10, or you start with the maximum that you can do. You understand? So you have to progress slowly. When you do it that way, you won't have these muscle pains. And the last thing is, have to learn proper technique, which may require some time. Yes, you have to learn how to lift things. You did not learn to lift your body up when you fell down, when you were 1 year old. At that moment, when you fell down, when you were 1 year old, you were crying, asking for help from your parents to carry you up, right? So you needed some time to actually get up from that floor by yourself. The same thing goes to lifting weight. So don't say lifting weight is hard. it's very technical. No, lifting weight is just the same. Like eating, lifting yourself from the floor, learning to sit, learning to sleep. Sometimes we don't even sleep with a right posture and we have pains around our neck and all that thing. So don't say lifting weight is hard. Lifting weight is yet to be learned properly. All right. I think that's it. A very short and sweet presentation from me. I hope so it was sweet. And I would like to thank every single one of you who joined in. And I have some reminder tomorrow that we will be having program. Okay, I think I can slightly talk in Malay. Kita akan ada program kesedaran kesihatan. Bagaimana pergerakan menjana keuntungan dan kesihatan. So this program will actually explain what is WOKLA, why people will benefit from WOKLA, and why you should be a part of WOKLA. WOKLA has been designed, developed, and structured for the benefit of, genuinely for the benefit of the community. All right. A little bit of wealth, a lot of health is waiting for you. Esok penceramahnya adalah Adli Zaharuddin, jurulatih WOKLA kami, salah seorang trainer. 13 Jun 2021, 2 hingga 2:30 petang. For who is this? You guys are already in WOKLA. So this thing is for you to actually learn to spread WOKLA to the community, to the entire Malaysia, and for those who are already interested. You might have people that you have already gone approach, explain the benefit of WOKLA and everything, but they might be thinking, so this thing, it will help to actually explain to them and make them realize the true benefit of WOKLA. So anyone that is interested, anyone that you think will benefit from WOKLA, basically whoever you think of will benefit from WOKLA. So bring them in, let them hear this 30 minutes, very short presentation by Adli Zaharuddin, and they will truly understand why they should be part of WOKLA. All right, Q&A, let's go. Who has questions? Let me pause it. I want to put it here. I want to put it, okay. Okay, what, first question. Which one is it? Okay, John Mallory. Is it recommended for women, for the women that after the pregnancy to do weightlifting? Yes, yes. After pregnancy, you can actually lift weight. For a few months, during the first postnatal, they call it right after pregnancy, you might need to rest if you wish. There are people who start training 2 weeks, 1 month after giving birth. So it depends individually. If you are ready, then you're ready to go. But make sure you get a proper exercise therapist, I would recommend, or any personal trainer out there. Make sure that first, because a person who does not know how to train a postnatal woman, who is going through a postnatal period, is not safe at all for you. So as long as you get a proper person to train you, you should be safe. A month or two after you have given birth should be good for you to start training. During pregnancy, you should train. All right. Training will actually keep your posture well balanced, will actually maintain the strength of your muscles so that you don't push your pelvic too much to the front. You know, when pregnant ladies, they have a very heavy abdominal, they tend to push it forward. So this type of things can be reduced. That is normal, but can be reduced. So lifting weights is normal as long as the person who is training you or you yourself know what you are doing. All right. The next question. What is the precautions for diabetes patients when lifting weights? Monitor your blood glucose. In our clinic, exercise clinics, every diabetic patient that walks in, they are monitored. Means before they start training, we get their blood glucose. After they finish training and even during their training, we monitor their blood glucose, because most of the diabetic patients are under medication. For those who are not under medication, we advise, if it is already severe, if their reading is already beyond normal, we normally suggest them to go and get doctor's advice and come to us. For those who are already under medication, they might eat those medication before training. Their timing of medication may interrupt with their training time. So we don't want them to be hypoglycemic or low blood sugar. sometimes diabetic patient, after even putting in the medication into their body, they feel kind of dizzy and all that thing. So we don't want that to happen in the exercise period. So if you're a diabetic patient, monitor your blood glucose, because when you train, your blood glucose will go down. So when it goes down beyond the normal level, you are going to be hypoglycemic. When you are hypoglycemic, you're going to either feel dizzy or you're going to collapse right away. So monitoring blood glucose is the ultimate and the most crucial thing to do with a diabetic patient. Other than that, you must look at their wounds. They might have wounds around their legs, right? So make sure it does not hurt them to actually train or worsen their wounds. It won't hurt them because they would have they will be numb around their legs because their diabetes have gone far from controlled, so they won't feel anything. But then you might actually worsen their wounds that's around their legs. So look for all these things. These are the two things that are very important, so that you don't hurt them, you train them, and you monitor their blood glucose. All right. So the next thing, how can I choose my weight for weightlifting? Choosing weight is a huge part of lifting weight. Okay. Again, in our in the place that I work, in MS New Symphony Exercise Clinic, we have a strength assessment called Dr. Fit Strength Assessment. So how do we assess is that we measure for every muscle, every major muscle that you're going to train, how much can you lift on that day? We actually measure that. But in the entire world, maybe in the entire Malaysia, only we have that thing. So for those who are not able to get these facilities, try and error. But I would not suggest it much. So whenever you want to start lifting weights, start light. Don't go for heavy stuffs, and you will never need heavy stuffs anyway. If you want to build muscle, make sure if you are doing bicep curls is everyone's favorite. So if you are doing bicep curls and you want to build muscle, make sure you can do 12 repetition, 12 times with the weight that you have. If you can only do 8 times, okay. If you can only do 6 times, that is too heavy for you. If you can do 15 times, that is too light for you. So that's how you choose. That is for building muscle, 12 reps. If you want to burn fat, as we are saying that Malaysia is the fattest country, right? So if you want to burn fat, 15 reps. So whatever weight that you choose to train, your bicep curls, your chest press, your lat pull down, whatsoever, it should be 15 reps. If you can do 20 reps, it is too light. If you can do only 10 reps, it is too heavy. So make sure you can do 15 reps. Okay, plus minus. Say 2 to 3 reps plus minus. Okay. Next. All the best, Rajesh. Thank you, sir. I appreciate it a lot. Another question. Can this take medication after start exercise? Doctor's work. Okay, so stopping medication and giving medication is doctor's work. I have no qualification to say that. All right, when they feel that when they train, for those who we can manage their diabetes, we have actually had clients who stop their medication after doctor's advice, because when they train, their glucose level goes down, and in a long term, it starts to actually go down slowly, so that they wouldn't need as much of a medication or a medication at all. So that's when we actually send them back to the doctors to get the doctor's approval. As long as they maintain exercise, when they stop their medication, it should be good. If they don't maintain, they might develop it again. So stopping and giving medication is doctor's work, but we know when and why should people start or stop medication. So we would normally refer it to the doctors. There are clients that we had stopped their medication, but the only thing is that you have to maintain exercising, right? It has to become your lifestyle. Next question. Is there any suggestion about exercise or weightlifting programs for spinal cord injured person? For spinal cord injury, I would suggest you to go and see a physiotherapist. As suggestion, I can't suggest anything actually before meeting you, all right? And we don't treat spinal cord injuries in our exercise clinic. Whatever injuries and rehabilitation, it is physiotherapists' work. So please meet them, get their advice, and see what you should do. As long as you follow all exercise principles and progress yourself slowly, you should not have any problem. First and foremost, you must assess yourself. How do you know you have spinal cord injury? How do you know you have hip pain? So when you get to know and you are diagnosed, then you meet the physiotherapist. They will teach you step by step. All right. Assessment is the most important thing. Don't self-diagnose. Always assess. When assessing, you will know what you can do and what you cannot do. All right. From here, although I might have the knowledge, but I cannot share it openly like this because people might try and it might hurt them. Because something that is suitable for you might not be suitable for another person. So I must assess, and I would like to advise you to go and meet the physiotherapist, right? For those who have lower back pain, is it okay for them to lifting weights? Lower back pain. When you have any type of pain, okay, don't have to be specific, any type of pain, and you lift weights, the lifting weights should actually reduce the pain. If it is increasing the pain, that means you are doing something wrong. Okay? So whenever you know that you are having pain in some areas, you must first assess the range of motion that you have in that area. So when you know how far you can move, when you know what is the movement that you can actually go through that joint, then you will know what type of exercises to do and what type of movement that is suitable for your body. So assessment, as I said, again, as I said earlier, again, assessment is the most important thing. Lifting weight is suitable for every single person, as far as I know. All right? Assessment. Okay, I think there's no more questions. What's the time? Wow. My fitness tracker thought I was actually working out because too much hand movement. 9 o'clock. We are done. 30 minutes with you guys. We'll see you guys next week. Thank you. I appreciate a lot that you join and listen to what I say. I'll see you next week with even more interesting topics. We have a lot of things to share with you. Our dear Kaki Walkla. Continue walking, continue earning your rewards, continue spreading this to the entire Malaysia. We'll see you next week. Thank you very much. Rajesh.